As I mentioned in earlier videos, SARS-CoV-2 uses ACE2 receptors in type 2 pneumocytes to enter and infect the cells. There are multiple drugs designed to lower blood pressure. Angiotensin-converting enzyme inhibitors, ACEIs, and angiotensin receptor blockers, ARBs, are highly recommended medications for patients with hypertension and other cardiovascular and renal diseases. We know from experimental animals that ACEIs or ARBs increase the number of angiotensin-converting enzyme 2 receptors in the cardiopulmonary circulation. Therefore, patients taking ACEIs or ARBs chronically for cardiovascular diseases are assumed to have increased numbers of ACE2 receptors throughout their cardiopulmonary circulations, as it is observed in experimental animal models. ACE2 receptors serve as binding sites for the anchoring spike proteins on the exterior surfaces of the beta coronavirus. SARS-CoV causes severe acute respiratory syndrome, and the phylogenetically related beta coronavirus, SARS-CoV-2, causes the novel coronavirus disease COVID-19. S proteins anchor both beta coronavirus to ACE2 receptors in the lower respiratory tract of infected patients in order to gain entry into the lungs. Since patients treated with ACEIs or ARBs will have increased numbers of ACE2 receptors in their lungs for coronavirus S proteins to bind to, they may be at an increased risk of severe disease outcomes due to SARS-CoV-2 infections. Patients treated with ACEIs and ARBs for cardiovascular diseases should avoid crowds, mass events, ocean cruises, prolonged air travel, and all persons with respiratory illnesses during the current COVID-19 outbreak in order to reduce their risk of infection. This warning is supported by the study I mentioned in the previous video, where from a descriptive analysis of 1,099 patients with laboratory-confirmed SARS-CoV-2 infections treated in China during the reporting period from December 11, 2019 to January 29, 2020, in that study the researchers reported more severe disease outcomes in patients with hypertension and other chronic diseases. So elderly patients who often have comorbidities, including cardiovascular diseases, hypertension, diabetes, and chronic kidney disease, are more likely to be taking ACEIs or ARBs and are at greater risks of contracting COVID-19 disease in children. Two mechanisms may protect children from COVID-19. First, cross-protective antibodies from multiple upper respiratory tract infections caused by the common cold-causing alpha coronavirus. And two, fewer ACE2 receptors in their lower respiratory tracts capable of attracting the binding S proteins from SARS-CoV-2. These immunological and molecular observations support the clinical observations of infrequent COVID-19 in children compared to more frequent COVID-19 disease in elderly patients, especially those with comorbid conditions.